Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Signs, symptoms and uses of syphilinum, Part 1. Full name, same, that is syphilinum. Source, Exudate from syphilitic sore. I have given a sign of exclamation that will be clear from the thing which I am now reading. To start with, I must admit that in Homeopathic Materia Medica, the source of this remedy is displayed as syphilitic virus, which I think is an error of legacy. During the days homeopathy was invented, man did not have any idea of difference between virus and bacteria. Now clinical pathology tells us syphilis is the result of a bacterium called Treponema pallidum. Further, in this case, the source can never be a virus or bacterium. Rather, it must be an outcome of bacterium and bodily resistance, the sore-like skin growth, which actually comes after infection of syphilis, after infection of Treponema pallidum. So I use the same as source above. The term has been coined by me personally, and I am sure it transpires the fact. The exudate from syphilitic sore, it is the source of syphilinum. Now, if you wonder how this obnoxious and nasty thing can be a source, you must know that homeopathy is a science where nasty thing can be converted into a nectar, that is amrit. That is due to preparation of the medicine. The preparation method, I mean the procedure of preparation of medicine, is such a novel thing invented by Dr. Hahnemann that every poison can be converted into a highly effective medicine. If you want to know details of this, then you have to read details into the procedure of preparation of medicines. That is, the discussion is beyond the scope of this particular video. This is the one image where syphilitic sore has been demonstrated. This sore is also available inside the mouth, on the tongue, on the genital organs, on various organs of the body. This is one of the sores that on the lip. What type of remedy syphilinum is? Syphilinum is a nojo type remedy, that is a remedy prepared from a disease product. Dr. Swan was the first to prepare it. As of now, it holds the place of king of antisyphilitics among the nojos so far proved. Dr. Herring remarks that no patient having syphilitic history in the past can be declared cured until and unless this nojode is administered at least once in course of treatment. What is the sphere of action of syphilinum? It chiefly acts on brain, spinal cord, bones, skin, mucous membrane of our system. Brains and spinal cord means CNS, that is central nervous system. On the right hand side, two extra examples have been given where the sore can be seen. You can on the tongue, on the body, trunk of the body. I have already told you that this sore, syphilitic sore, can be seen on various parts of the body. What are the therapeutic uses of syphilinum? Therapeutic use means specific disease. Uses against specific disease. Syphilitic skin affection, such as ulcers, boils. Inveterates constipation, headache. Rheumatism, sciatica, eye affection, ptosis, vertical diplopia. Heart troubles, valvular heart diseases. Leukorrhea, neuralgia, bone affection, angina, tooth decay, periostitis. Problem of central nervous system like slowly advancing hemiplegia, epilepsy, etc. Now just look at the figure. This is the syphilitic skin affections. This particular type of ulcers, note this, the coppery colored flat type of ulcer, these are the characteristics of syphilitic infection. Actually, this type of ulcer is seen after syphilis, after primary syphilis is over, then this secondary syphilis possibly comes here. Here is the ptosis. Ptosis means just hanging down of the upper eyelid. This is paralysis of this ocular muscles, and this is this bone periostitis, bony inflammation from syphilitic infection. Mental general symptoms of syphilinum: loss of memory, fail to recollect names of persons, books, places of very recent past, unable to do mathematical calculations, sensation as if going to be insane, as if going to be paralyzed, apathetic and indifferent attitude, terrible dread of night for coming mental and physical exhaustion on rising from sleep, prefer death to the insufficient exhaustion. That is, the exhaustion which these persons felt after rising in the morning is so painful that they prefer death to this. Hopeless and despair of cure, antisocial, horrid depression, cross, irritable, very nervous, laughs, weeps without cause, impulse to wash hands again and again, washing mania, nightly delirium, syphilitic insanity. Syphilitic insanity, actually insanity, we know what is insanity. This syphilitic insanity actually mimics every known form of mental disorder, including acute mania, ordinary melancholia, terminal or paralytic dementia. Everything. Averse to company, sad and lamenting, does not want to be soothed. On the right hand side, the images, this is the person who is suffering from loss of memory. This is the person who is suffering from very much depression, hopeless state, and this is washing mania. Physical general symptoms of syphilinum. In any chronic disease, when well-indicated remedy gives partial result and there is hereditary tendency to alcoholism or history of syphilis in family, this medicine rescues. Unfathomable weakness without any apparent cause in the morning. Note the term, unfathomable weakness. Dwarfed, shriveled up, old-looking babies, children with bald head, pouting lips, and big bellies with foul odor of the body. Please look at these images. The face of the child, These faces, these are not normal faces of babies or children. You try to remember the face, the appearance, and if you see in your practice such type of babies or child, give them one dose, say 1 ml or 10 ml, a very small dose. This may change their whole lifeline. Successions of abscesses with fetid green pus, knots in the muscles, pain in other conditions worsen or lessen gradually. Pain or other conditions worsen gradually. This is a characteristic symptom of syphilinum. Syphilinum symptoms comes gradually, goes gradually. Persistent pains anywhere in the body. Slowly advancing hemiplegia, enlarged glands, Hodgkin disease. You see this, the Hodgkin disease. Hodgkin disease is actually Hodgkin lymphoma, Hodgkin disease, same thing. This is actually cancer of lymph glands. It's a very serious disease. Showing pain in long bones, bone sore, caries, carved exostosis. The showing pain in long bones. Stubborn ulcer having no tendency to heal up. Mind this, stubborn ulcer. Where ulcer? Why ulcer? You need not know. You just take the symptom. The patient will report that this ulcer is there for last 6 months. I have tried so many medicines. Nothing is working. That's enough to select syphilinum in the particular case. General aggravation and amelioration of syphilinum. What's night? Sundown to sunrise, there is whole night. Damp, extreme heat or cold, every alternate full moon, during thunderstorm, motion, raising arms laterally, squatting, winter, summer, seashore, better. Continued or slow motion, changing positions, high altitudes, applied heat during daytime. Now particular symptoms of syphilinum, first one coming, head symptom of syphilinum. Deep bursting headache across the base or temples. Patients beat head against wall to get relief. See this figure. He is hitting wall with his forehead to get relief. Feel head pulled backwards. Hair fall profusely. Vertex as if bursting. Tubercle all over the scalp. All over the scalp, tubercle. Eye symptoms of syphilinum. Chronic recurrent flictinular keratitis. Flictinular keratitis means actually inflammation of cornea as well as conjunctiva with intense photophobia and lacrimation, better by cool bathing. Vertical diplopia. Vertical diplopia is when the image is one image is seen above another. One image is seen above another. This is vertical diplopia. Diplopia two type: horizontal type, vertical type. This is vertical. Ophthalmia neonatorum. Ophthalmia neonatorum means newborns. Ophthalmia of the newborn. See these newborns' eyes fully agglutinated. This is ophthalmia neonatorum. Squint. This is squint. Amaurosis, spots on cornea. On the cornea, spots. Amaurosis actually vision loss of vision. The loss of vision, there are various forms. This is central vision loss. There is peripheral vision loss. And this is optic nerve, which generally carries sensation from the retina to the center where this sensation of vision gives. This optic nerve, atrophy of this nerve is also covered by syphilinum. Mind is all these symptoms are related to nervous symptom, related to nerve, not any other type of pathology is there. Ear symptoms of syphilinum. Abscess of the middle ear, calcareous deposits on tympanic membrane, deafness without any obvious cause. Look at the figure on the right hand side. This is the anatomy of ear. Anatomical structure here has been shown. This is external ear or pinna. This is the external auditory meatus. This is membrane, tympanic membrane, and this is the cavity. This is called Eustachian tube or auditory canal. And this within this canal at the top end there are three small bones, malleus, incus and stapes. This constitute the middle ear, and these snail-like structures with half circular structures, this is called internal ear. Now in syphilis we get abscess within this middle ear, calcareous deposition on this tympanic membrane, so the person becomes hard of hearing, because when calcareous deposition on calcareous deposits accumulated on tympanic membrane, the tympanic membrane becomes thickened and the person tends to be deaf. Note symptoms of syphilinum: ozina, offensive thick yellow-green discharge, pain in sinuses, snuffles, itching of nostrils, fluent coryza, septum of nose perforated. See, this is the picture of ozina or atrophic rhinitis. This is a painful, destructive and nasty disease where the person who is suffering from the disease, his life is hell, and the persons around him, the lives of those also becomes hell, because this disease is so horrible that in ancient times their hospitals of the Ozina persons completely separated from other blocks, and it is situated in a separate segregated area, so obnoxious smell comes out of the particular disease. Now the disease is possibly less compared to earlier times, but still it's a very destructive. The whole structure of nose is lost, destroyed completely. That the whole structure of nose is destroyed. Now pain in sinuses. Sinuses has been shown here. This is the sinus picture. This is frontal sinus. These two are called frontal sinus. Ethmoid sinus is inside within the brain structure, skull, and maxillary sinus on the front side, maxillary sinus. Sphenoid sinus also within the brain. The pain in these sinuses also comes in this, covered by this syphilinum. Septum of nose perforated. Naturally, the septum is completely destroyed during ozina, so there will be perforated naturally will come. But there may be also fluent coryza from nose. Itching of nostrils, snuffles. Snuffles means just watery discharge with sneezing, etc. These minor things are there. Again, severe, deep level structures destruction is also there in syphilinum. With this, this video ends. We will take up the remaining portion of syphilinum in the part 2.